ladies and gentlemen. Thank you for all of you staying behind after the very long, 3 long days of the symposium. This comes to the final sessions. We would like to discuss about what are the diagnosing and treatment approach, especially in the Asian perspective. Because Asian is such a large continent, there's much variations in their populations, their standards, including economics or the healthcare standards. But we all have to face the diagnosis and treatment of the child cancers. So for the diagnostic tools, I think in the past 2 days, we learned a lot about the histological diagnosis, but now there is a trend of getting to be more on the genetic basis. The genetic diagnosis is getting more and more important. It's important, firstly, making the accurate diagnosis and also giving the prognostic value. And some of these tests also provide the disease activity and their monitoring. Of course, finally, we hope to get target therapy based on these genetic changes. And other than making a diagnosis, another important aspects of the diagnostic tools is for the staging investigations. We are all performing standard radiological examinations, but now there are also radioisotope scannings. The PET scan is now, the PET-CT is now quite commonly performed, but CT scan is having radiation, so people also propose to have a PET MRI that will help to reduce the radiation damage in the long run. But how to choose the diagnostic methods? Because there are getting more and more new diagnostic methods available. So we have to look at the availability, accessibility, and affordability. You may do the whole genome exon sequencing, but is it really affordable, and is it really having the impact on the management? So even though we have very promising early results from some of new technology, but is it really evidence-based? So that is something we have to consider when we are considering some new treatment. And more important is the validity of these diagnostic tests in the pediatric diseases. Some of these may be conducted mainly in adult studies. Does it apply to children as well? And is the laboratory accredited for such tests? They may be excellent in the research platform, but is that really now mature to be in the clinical testing stage? So sometimes it's also quite difficult to have well-designed studies on these new tests, and we may have to face the false positive and false negative results. There are many diagnostic tests like what Carlos talked about, the rhabdomyosarcoma, and the pH-like ALL also getting very common, and also the pharmacogenomics and the MRD. These are all tests getting more and more commonly used. And then come to the treatment approach with curative intent. We always hope to have ideal therapy. This morning we heard about the late effects. So we hope to see our survivors. They have the best chance of cure, but with least acute or late toxicities. But at the same time, is it cost-effective? Is it affordable by the countries? Some of our countries in Asia is still developing countries. They may not be able to afford the high cost. The target therapy is still not available to all types of cancers, but they may be able to achieve the better disease control. Not uncommonly, they require the combination of these target therapy with the conventional therapy to increase the chance of cure. But some of the studies allow also try to reduce the treatment intensity, just like the rituximab used in the B lymphoma. And immunotherapy is also coming into our practice very soon. However, with these emergent therapies, who will benefit? For the molecular therapy, you can see a long list, and antibody therapy also getting a longer and longer list, and also the cell therapy as well. But who can benefit from these, at the moment, still quite expensive treatments? Not to forget about palliative care, because even though we are having better chance of cure for our children with suffering from different types of cancers, there are still 10 to 15% at least. They will die from the cancers finally. So we should not just concentrate on the curative intent, but palliative intent is also important, especially in the countries that have more poor resources, that their curative methods may not be available, and so palliative care should be provided to children who cannot be cured with the modern treatment. So this requires the education of public, the training of medical personnel, and also, as we discussed this morning, like a psychosocial element is also very important. The drug accessibility is something that we should work with the WHO and for not only for the treatment, curative treatment, the symptom control as well. And we need a decent environment for the hospice care as well. So I'm just trying to bring up some questions for your discussion. I don't have any answers on this. Okay, so I think I will pass to the next speaker. Thank you.